Hi, everyone, and welcome. Today, let's talk about something that I know can feel, well, really confusing and even a little lonely. Our goal here is to create a space where we can understand our bodies a little better together. You know that feeling, that bewildering burning that shows up hours later? Gosh, it can be so unsettling. So, first things first, let's just acknowledge it. What you're feeling is real, and I promise you, you are absolutely not alone in this. All right, so in this first section, we're really going to validate this symptom. It's so hard to pin down. We'll start to gently unravel the mystery behind why this happens, so you can feel more informed and a lot less in the dark. I want to be really clear about this. The feeling is absolutely real. And I get it. That delay, it can make you second-guess yourself, right? But think of it this way. Your body is just trying to send you a message. There are clear biological reasons for this, and no, you are not imagining it. Okay, so now that we've established that this is a real signal, let's get into the why. Your body has a couple of main ways it can create this feeling. And please, don't think of this as scary stuff. It's just information. Clues to help us understand.
So think of it like two different stories your body might be telling you. The first story is all about what's happening right on the surface of your skin. That's something called contact dermatitis. The second story, that's about the nerves underneath and how they're sending signals. That's what we're talking about with a condition called Vulvodynia.
Let's break down that first one, contact dermatitis. You can almost think of it like your skin's own personal security system, but it's a little slow to react. It spots something it doesn't like, an irritant or maybe an allergen, but it takes a while to sound the alarm, and that's why you don't feel it right away.
And when you look at what can set it off, wow, it's stuff we used every single day, isn't it? That scented soap you love, the residue from laundry detergent, even things we think are helpful like certain lubricants. Our vulval skin is just, well, it's incredibly sensitive, and sometimes it just needs a little break from these things.
Now, for that second pathway, this one's a bit different. It's about the nerves themselves becoming, let's say, a little overprotective. This is what's known as vulvodynia, and it's so important to hear this. This is not all in your head. It is a real physical change in your nervous system.
So you're probably wondering, how on earth do I know which one it is? Well, the timing is your biggest clue. It's like being a detective for your own body. If that burning sensation shows up, say, 12 to 48 hours later, that really points toward an immune thing, like contact dermatitis. Paying attention to when it starts can tell you so much.
Okay, but here's the most important part, the part with the good news. Understanding what's happening is a huge first step, and the next is knowing there are absolutely ways to find relief. So let's talk about some gentle, effective things you can do, starting right now, at home. These aren't huge, overwhelming changes. They're small acts of kindness for your body that can give you back a sense of control. Just taking a look at your products, switching to comfy cotton underwear, or using a simple cool compress, these things can make a world of difference. And you know what? If those home care steps don't solve it completely, that is okay. That's what medical support is for. And it's not a one-size-fits-all approach. As you can see, the treatments are really specific to the cause, whether it's a cream for skin inflammation or different options to help calm those overactive nerves.
Navigating this is so much easier when you have someone in your corner who really gets it. And that's why I'm so happy to introduce you to Dr. Farzana Khan from the Women's Health Clinic. She is just a wonderful, compassionate guide in this field.
This quote from her really says it all, doesn't it? It's all about making sure you feel heard and empowered. You become part of the team, making decisions with your doctor, not just having them made for you. And that's how it should be. And she brings so much experience to the table. We're talking over 2 decades dedicated to women's health. From her graduation all the way back in 2003, through specialized training to now being a leader in the field, she has a deep, genuine commitment to our well-being.
All right, last but definitely not least, let's talk about when you shouldn't wait. It's so important to trust your gut, but there are also some very clear signs that mean it's time to get professional care right away.
Listening to your body is everything, and if it's telling you something is really wrong, please listen. If you see any of these things like serious swelling, a fever, or a rash that's spreading, that's your cue to call a doctor pronto. Don't hesitate. At the end of the day, remember this. This is your body and your health journey. And just by being here, just by learning, you're taking that first and most important step toward empowerment and healing. So, as we wrap up, I want to leave you with a little something to think about. What's one small, gentle thing you can do for your body today? Maybe it's just giving yourself some grace.
We just hope you walk away from this feeling a little clearer, a little more confident, and knowing that you're supported.